Today I'm going to talk about pneumonia. Pneumonia refers to an infection of the lung tissue. Unlike a simple respiratory infection, pneumonia has associated changes on a chest X-ray. For example, consolidation. If a young and healthy person develops community-acquired pneumonia, they have a good prognosis and can be treated in the community with oral antibiotics. However, mortality is high in those who have poor immune systems. There is also hospital-acquired pneumonia, which is defined as an infection greater than 48 hours after admission to hospital. There are a lot of different organisms associated with pneumonia. Sometimes the organisms can be divided into typical and atypical, if they are bacterial, that is. Typical pneumonias include strep pneumococcus and Haemophilus influenza. These represent 65% and 20% of all causes of pneumonia. A vaccine to strep pneumonia is available. Haemophilus influenza is frequently seen in patients with COPD. Atypical pneumonia simply means pneumonia that is caused by an organism that cannot be detected via gram stain or easily cultured in the lab. It is important to be aware of atypical pneumonia, as these pneumonias do not respond to penicillin. The three atypical pneumonias of note include Legionella, Mycoplasma pneumonia, and Klebsiella pneumonia. Legionella is spread via contaminated water sources, for example hotels. It is associated with deranged LFTs and low sodium, hyponatremia. A Legionella urinary antigen can be tested for to aid in the diagnosis. Mycoplasma pneumonia. This pneumonia can cause neurological symptoms. The way you can remember this, and the way I remember this, is in Mycoplasma is also present in myelin. And the myelin sheath surrounds our nerves and is thus associated with neurology. They both have my in them, so we can think of neurology. It may present also with flu-like symptoms, mycoplasma pneumonia, followed by a dry cough. It is diagnosed by PCR of sputum or serology. A complication of this pneumonia is a skin rash known as erythema multiforme, and it has characteristic target lesions. Klebsiella pneumonia is seen in alcoholics and malnourished individuals. This pneumonia is associated with cavitating lesions on chest X-ray, and it's associated with lung abscess and empyema. There's also viral causes of pneumonia and fungi. Of note, a fungal cause of pneumonia is PCP, and this is commonly seen in patients with HIV who have a low CD4 count. It presents with dry cough and no sputum, and it is treated with an antibiotic, cotrimoxazole, and patients who have HIV are often prescribed this prophylactically to protect against PCP. PCP is associated with exercise-induced desaturations and often has no visible chest signs. So what is the presentation of someone with pneumonia? Well, they're typically breathless, can have a cough, tachycardia, fast respiratory rate, fever. And what should be done in all patients presenting with pneumonia? Well, they should have a full examination, a full history. On examination you may find coarse crackles, and bronchial breathing. And bronchial breathing is simply when there's an audible pause between inspiration and expiration. There should be no pause between those breath sounds in normal breathing. And NICE guidelines suggest the use of the tool Curb 65. Now this is very important, it comes up a lot in exam questions. Curb 65 is scored out of 5. C is for confusion, and you score if you have an abbreviated mental test score of less than 8. U is for urea, and you score if the urea is more than 7 millimoles per litre. R is for raised respiratory rate, and you score if it's greater than 30 breaths a minute. And B is for blood pressure, a diastolic of 60 or less, or a systolic of 90 or less will score. And 65 is age over 65 you score. And the curb can be useful because a score of 2 or greater should be managed in hospital, a score of 0 should be managed in the community, and a score of 1 can be managed in the community provided the patient is maintaining their saturations and a chest x-ray does not show bilateral shadowing. And ABG is also a useful test to do if someone's breathless and desaturating, and blood tests should be done such as FBC, LFTs, which are deranged in Mycoplasma and Legionella, and a chest x-ray. When is a urinary antigen test useful? If you suspect pneumococcal or Legionella pneumonia. And what is the management of community-acquired pneumonia? Well, this depends of course on whether it's typical or atypical, if the patient has any allergies, and what are your hospital's guidelines. So in mild community-acquired pneumonia, you normally get a 5-day course of a single antibiotic. This is normally amoxicillin, whereas in moderate to severe community-acquired pneumonia, 2 antibiotics are normally used, one of which is commonly amoxicillin. Thank you for listening to this video. If you enjoyed it, don't forget to like and subscribe to this channel for more medical videos.